We do a lot of sedation. I've gotten to the point where I do IV sedation, we do oral sedation, we even do nitrous oxide. It just depends on the patient's need.
And who benefits the most, by the way, from this? I mean, like, who are the type of patients that need IV sedation?
Well, sometimes it's me that benefits the most because I don't have to be nervous about what they're feeling or what they're worrying about. Okay. But the patient, for these people, most of these people, they haven't been to the dentist for 10, 15 years. And in 2 appointments, we can get them all back together again. It's a wonderful, wonderful experience for them and us. It's one of those transforming experiences.
So it's a fear. Like, are these like almost like dental phobics?
Yes, these most often are dental phobics. To give you an example, Randy, I had a patient in just recently, and his name was Bob, and I walked in the room and he had the yellow bib on. The yellow bib in our office means my assistants say this is a sedation patient.
They're afraid of the dentist.
This guy's afraid.
Look at the yellow
I walked
bib.
in and I looked, and he is physically shaking in the chair.
Okay.
Shaking. I mean, he's shaking. And I walked in and introduced myself, and he said, Doc, he said, I've never been to the dentist, and I think I'm going to have to be sedated. And this gentleman was almost 60 years old.
Never been?
Never been to the dentist.
Okay.
And I looked at him and I said, Bob, I looked him square in the eye. I said, one of us is going to have to be sedated. And I prefer it be you. He looked, and he got this great big grin on his face, and he said, I think we're going to get along. And he stopped shaking.
So I guess when you're dealing with somebody that's so afraid, you have to kind of break the ice.
Absolutely.
With some humor.
You got to have a relationship with these people before you're gonna.
So that was your icebreaker.
Yeah, it was just one of those. It was the perfect moment for him. So for him, we were able to replace missing teeth with bridges. We were able to restore teeth with fillings. We were able to clean him up. He had periodontal disease. We were able to control that. Now he comes for regular checkups and cleanings. He's got no problems. And he's not even afraid to come anymore. That's what's really amazing. This guy was so afraid that he was shaking. He actually comes and has this done without sedation now. It's amazing. It's been a wonderful transformation. He's become a friend.